Since 1979, Link sent the ENDO model knee system on a mission to help surgeons with an easy solution for complex knee replacement surgeries. Join us on a trip around the world to see how the ENDO model network has grown. Let us begin our journey at the Helios Endo Clinic in Hamburg, Germany.
Hello everybody, dear ladies and gentlemen, dear colleagues. I'd like to greet you here from the Endo Clinic in Hamburg. The Endo Clinic is the birthplace of the Endo model, which exists now since 40 years. 40 years ago, my former colleagues, Dr. Engelbrecht and Dr. Nieder, designed together with the engineers from the Waldemar Link company this kind of rotating hinge knee. The ENDO model is the first intercondylar knee which exists all over the world during that time. Now I'd like to talk a little bit about the technical features of the ENDO model. One of the most remarkable features is the position of the compromised axis. This axis is positioned in the posterior part of the joint. That leads to a decreased pressure of the patella against the shield. A second design feature is it has the ability to rotate during flexion, and as more you extend the knee, it is impossible to rotate. In full extension, it becomes a pure hinge knee. Another quite important feature is the stop of the prosthesis in full extension. It is not a very hard stop at the end of extension. It is quite a soft or smooth stop due to the polyethylene inlay and a very nice stopper, polyethylene stopper inside the knee. I like to show you now that it's really the truth what I like to say you, that it's possible to do this kind of surgery worldwide, and I like to take you now with me to a journey all around the world.
Hi, I'm Brett Levine from North America, and I'm going to tell you something about the ENDO model and the reasons that I tend to use it, particularly in the setting of infection. The ENDO model has been a great addition to the portfolio for me and what I offer to my patients, particularly again in the setting of infection, where we're oftentimes dealing with a two-stage exchange procedure, which is the most common procedure for infection in North America. When we come back in to reimplant patients, oftentimes there's flexion extension mismatch issues. There's oftentimes problems with the skin, and the ENDO model allows us to adjust the flexion extension gap and treat that independently, as well as occasionally shorten the limb so that we can get the skin closed or improve their ability to flex their knee. Overall, it's been the implant of choice for me for a hinge for the past 5 to 7 years. And most of our fellows that graduate now, it's their hinge of choice when they go into practice. So overall, I've been thrilled with the results over the last 5 to 7 years. It's provided good outcomes for my patients. We've had a lot of success with it. It's easy and reproducible to use. So I appreciate the Link ENDO model, and I'm happy it's been around for 40 years and certainly for the last 5 to 7 years of my practice. With that, I appreciate you listening, and I'm going to turn it over to Dr. Rocha from Latin America.
Hi, I'm Cesar Rocha from Colombia, South America, and I would like to share with you my point of view regarding the use of ENDO model in primary total knee replacement. Although most of the patients with moderate and severe osteoarthritis are treated with conventional implant, there is an important number of patients that, in addition to osteoarthritis have a severe angular deformity in valgus or varus, which make surgical management more challenging, and even more if this patient presents a significant instability with incompetence of the collateral ligaments, which can lead to failure if treated with conventional implants, failure in terms of dislocation and early loosening. From this point of view, the most successful solution in my hands is the use of ENDO model as an implant that allows first to correct an angular deformity in varus or valgus, and second, a safe medial and lateral stability with a high mobility up to 145 degrees of flexion. The history, the long-term follow-up of this implant make to ENDO model as a strong tool in selected cases of primary knee replacement. Thanks for listening, and I'm handing over to UK.
In the United Kingdom's National Joint Registry, the ENDO model has been the #1 used hinge since 2002. They documented survival rates comparable to primary total knee surface replacements. Let's meet Mr. Ben Clift, consultant orthopedic surgeon at the Ninewells Hospital in Dundee, Scotland.
Hello, my name is Ben Clift. I'm a consultant orthopaedic surgeon in Dundee in Scotland, working in the National Health Service. I've been using the link rotating hinge knee for the last 21 years. I've been a consultant for 23 years, and I've been using it primarily in complex cases. The first time I saw it was actually in the adverts in the Journal of Bone and Joint Surgery, and I couldn't quite work out how the rotating hinge mechanism worked from the pictures. That was intriguing. And when I had a case which I thought would be appropriate for it, which was a primary knee with ligamentous instability, I got the implant in and I was delighted by it. It worked very well for that case, and I wasn't the only one delighted. The theatre staff thought it was great too, because it had a very simple instrument. It still has that. Very simple trays to get sterilized and to learn. So that was the beginning of quite a regular usage of the implant over a long time, but mostly for revision cases, and many of them at the more complex end of the spectrum in relation to fractures, periprosthetic infections, whether 2-stage or 1-stage, which is a particular advantage the link has with the teaching of the Hamburg School. And we continue to use it not for every revision, but for many different cases, and many of them salvage cases for which I don't really have a good alternative in many respects. The most common one that I use is the distal femoral replacement if I'm not doing an ordinary link rotating hinge, but I have used a total femoral replacement as well, and I have to say, out of all the different prostheses I've used for that operation, it's certainly perhaps the simplest and has been very straightforward to use.
Hello, I'm Associate Professor Karen Fielding from Australia, and I'm here to tell you something about the ENDO model, distal femoral replacement. I've been using the ENDO model since 2016. Why do I use the ENDO model? I think it's a fantastic option for people with distal femoral fractures and periprosthetic fractures that gives them one safe operation that gets them up and about, mobilising quickly. I'll give you an example. Here's a patient and some x-rays of that patient, her left leg and her right leg with the ENDO model in situ. This patient is a 75-year-old, very obese woman who had had bilateral total knees 10 years previously. She had had poor mobility for the last 5 years and was housebound. She had a simple fall and sustained bilateral periprosthetic fractures of her knees. I believe that the ENDO model is an excellent operation for a patient like this, to try and get this patient up and moving quickly back to their home environment, with a reduction in their post-operative bedtime. Post-operative complications are reduced, thereby their comorbidities are managed better. For example, DVTs, pulmonary emboli, wound infections, etc. I think this is a good example of where the ENDO model is useful. I'd like to hand over now to Dr. Leila from Africa, and best wishes to Link.
Hi, I am Dr. Lele from Kenya, and I'm going to tell you something about the indications of ENDO model. The main indications of ENDO model here in Kenya are: 1. Revision of failed primary total knee replacements. Number 2 are patients with severe Varus or Valgus deformities of the knee. Any deformity beyond 15 degrees of Varus or Valgus, we use ENDO model. And the third main indication is patients who have no collateral ligaments or severe injuries of the knee. These three main indications have been like a savior to the patients of this country, as the only other available options were very expensive or to travel outside the country. Thank you very much for listening, and I'm going to hand over to Dr. Reddy from Asia. Thank you.
Hi, I am Dr. Guru Reddy, Chief Joint Replacement Surgeon, Sunshine Hospitals, Hyderabad, India. I use the ENDO model hinge process for the last 5 years, and it's one of the excellent implants I've used in my life. It has bailed out in difficult circumstances many times, and I use it extensively for comminuted fractures of the lower end of the femur and periprosthetic fractures after the knee replacement surgery in 70-year-plus ladies who got osteoporotic bones. Sometimes I even replace the lower part of the femur, which is completely shattered. And this implant has given me a quick fix solution, which is long-lasting and excellent outcome to the patient. The patients walk on the second day, and I'm quite pleased with the results of the ENDO model hinge process. This is my hinge process of choice any day. I'm now handing it over to Professor Thurston Gerke, Hamburg.
Welcome back, and thanks to my colleagues and friends from all over the world. Wonderful statements. Another wonderful news is that still, even after 40 years usage of the ENDO model, all parts, all spare parts are still available. Another good news is that we are working very hard on new designs and new design features to improve the survival rate and function of the ENDO model. One of it are these kind of cones. These are cones who are especially designed for implantation in combination with the ENDO model. Wonderful cones with a perfect surface which allows good bony ingrowth and elasticity. The elasticity allows the cone to adapt to the defect in the bone. I hope that all these experiences and statements will give this kind of implant a very good and wonderful future. I like to thank the Ultima Link company for the hard work that they have done to provide this perfect revision knee for all the surgeons all over the years. And I congratulate the ENDO model to his 40th birthday. Thank you very much.
We're continuously working with the best surgeons worldwide to ensure that the ENDO model knee system continues to be a first-class solution for complex primary and revision surgery. Link. Moving on.